Is there a health professional on board? What do you say? The answer is yes. There's a health professional on board. And you go and offer your services, tell them what you are and what you do, and then be prepared to assist. That's what aviation emergencies are about. And in this crazy time that we've been going through here with TSA problems and flight control problems and all of that, there's still a lot of really nice people who are trying to fly. And some of them have medical emergencies while they're on the airplane. I had that happen to me recently. I've had it a lot in my career. And I'm sitting in a hotel room now where I had to come here by plane. And so we have to deal with these things. First of all, you are not at risk for doing anything. And I don't want anybody to think that there's any regulation that prohibits you from participating as a very good health professional, probably the best health professional on the plane to be able to manage an emergency with another one of the passengers or flight crew members, which I've had happen to me before. Number two, it doesn't matter if you have jurisdiction in whatever airspace you're over. You're federalized at that point and you do it. Here's what you need to prepare for. Typically, these are medical events, not injury events. Occasionally, stuff happens. Somebody gets cut, or they get burned, or they drop something on themselves. And taking care of injuries in the flight time is typically not something very difficult. Medical is a little more difficult, and what happens is a lot of people pass out, and there's very good reasons for that. Typically, you're dehydrated, you're forced to sit up. You may be in the middle of a transition time for a lot of passengers in between time zones and other things. So what do? You say yes. You take a look at the passenger, and a very important part: the kits that are set up in commercial airlines are ones that have been designed by the FAA many years ago. They haven't changed. They typically don't have the instruments that you need. Those instruments are in the overheads in the passengers who are flying with you. The immediate thing in my head as I'm asked to respond to somebody and I take a look at them, would you please make an overhead page and ask for somebody who has a glucose meter and a pulse oximeter on the plane to get it out and bring it to us. We will use it for a while and then return it to them. Some people also have lactate meters, and there's a few emergencies where a lactate meter would help. You begin the assessment of the patient with your hands. They may have a stethoscope, it doesn't work well. So you use your hands, you use your brain, you put the patient in a position where you can manage them. It may be in the floor, it may be in their little galley area, and you begin to assess them typically down. You prepare to do an intervention if needed, like compressions. They have defibrillators on board. In American airplanes, you may need to use those. You got to have the tools, though, that come either out of two big bags that the FAA has prepared. You're going to have to lay those out and look through them because there's no organization that you all know, and use what comes from other passengers to be able to do the assessment. And then the key for you is you're going to have to help the flight crew determine if that plane needs to be diverted. That's one of the most important things that they'll ask you. Is this an emergency that requires us to get to the ground quicker than what we're scheduled? In general, you can handle this without diversion. Please be an intervener. Do what you need to do. Take care of yourself, but take care of your fellow passengers. Makes the flight better. Doc Talk. We'll see you in a month.